Hello and welcome to Natural Healing with Oriental Medicine. I'm Grant Boxleiter. I'm joined by Dr. Stephen Wrench of East West College of Natural Medicine, and we're going to be talking about acupuncture. But right now, though, I'd like to send it out to the president of East West College, Russell Badiata.
Thank you, Grant. Acupuncture has been in existence for thousands of years, and it's the oldest healing modality on the face of the earth. It employs the insertion of very fine hair-like needles into specific points on the skin known as acupoints, or triggers. These triggers were discovered by massaging tender areas during the course of disease or painful syndromes. Today, over 400 known acupuncture points exist, which are located on 12 specific pathways or meridians throughout the body. By stimulating these points, the physician can learn gently how to coerce the body to do what it already knows how to do, which is to repair itself.
Thanks, Russell. We'll be checking back with you later when we see a demonstration of acupuncture. And Dr. Wrench, we just heard from the president, so I guess I just want to start out by asking you, what is the definition of acupuncture?
Well, Grant, I think as everyone knows, acupuncture is an ancient form of healing. In fact, as our president, Russ Badiata, just said, the oldest healing modality on the face of the earth. And I think it's interesting to note how we came by this information, or more specifically, how the Chinese came by this information is anyone's guess. We say sometimes it's 2,000 to 4,000 and as much as 10,000 years old. And here's what we do know. They found artifacts in grave sites in China, in old provinces in China, and they dug them up and they found what are very crude stone needles, not necessarily the kind that would penetrate the skin, but an implement that might be used to apply pressure, much like acupressure might be, on specific points on the body.
Like a pressure point?
Exactly. And then they found very crude bone needles and even bamboo slivers. And they feel that these were used to penetrate the skin. And some of these things are carbon dated 10,000 years or more. So when we say, that's why I know it sounds, we're vague, we're not specific. But what we do know is that books really weren't written until the printing press came around in the 1400s. So everything was kind of on, from stone tablets to parchment to scrolls and things like this. It was more or less handed down from the little village physician to what would be his apprentice.
Right.
And so, but we can say it's an ancient form of healing that pays attention to specific tender points on the body, which we address today with what Mr. Badiata said, very fine filiform. Now the word filiform means hair-like structure. So when we think of a needle, we all think of having blood drawn from a vein,
right,
or having, like a B12 shot or a flu shot. I can tell you that acupuncture needles literally, and if I had brought one today, I could show you, you can literally tie an acupuncture needle in a knot. It's literally a thread, a filament. And the only way it actually penetrates the skin is it passes through a little plastic tube, not much larger than itself. And as you know, because you had acupuncture that time at the clinic, we give it a little tap, and then we just remove the tube, and then we insert the needle. But what we do know is that the body is mapped, as you heard, with 12 meridians, which are like little energetic superhighways that traverse the human body. They run primarily from top to bottom. We named these meridians thousands of years ago after organs with which it's believed they connect. So stomach, spleen, heart, kidney, and so on.
So they're throughout the body from head to toe?
They are head to toe. And by stimulating points, what we want to think about is if the body is mapped with this very unique little superhighway system, we'll call it, and along these little these channels are acupoints, as Russ told you earlier. They're really, like he said, also triggers or keys. I often use the analogy of a computer keyboard.
Yeah.
That we punch up certain keys and we get a specific response as a result. So when we want to communicate with a specific region of the body, a specific organ in the body, or address a specific pathological condition within the body, we literally kind of dial it up. And the hard work's been done over centuries. So we really just know from their research, hit this key, this key, this key, and this key, and generally speaking, we'll get the desired response.
Now, how has acupuncture evolved since it's come to the West?
Well, it's no longer really, it's no longer really just considered Eastern medicine, and we've talked in previous shows about how do we label this. and we all in our society want to label everything. So we say, well, are you guys alternative medicine? Are you integrative? Are you holistic? Are you complementary? All these things. And I always use this term. We like to call it intelligent medicine. But it's taking on a more functional approach, hence the name of the college, East-West. It's no longer the same medicine specifically that was practiced thousands of years ago in northern and southern China.
So there's a different approach.
Absolutely. But today in our clinic, it's not, we call in laboratory testing. We have imaging work done. We do nutraceuticals. We do injection therapies. We do laser therapy. So it's no longer just the little old Chinese doctor in the village with a needle in his hand. While we still do a lot of these things, it's evolved exponentially away from the way it was thousands of years ago.
And when we talk about how long it's been in existence, we've kind of mentioned you date back almost 10,000 years. But has it constantly evolved from then, or was there a time where it stayed pretty much this is the way it was, but then new research came about and it kind of there were some elements added to it?
Well, there was a period in China, and it was really in the time of Chiang Kai-shek, if you remember that in your high school history a little bit, when Chinese medicine was forbidden to be practiced in its ancient forms, in lieu of, well, we have to be more like the West. We have to learn this Western medicine concept. We need to get a stethoscope, take blood pressure, we need to understand x-rays, and we need to start learn their surgical procedures, which they did, and beautifully so. So in China, when we think about it, it's very, very integrated now. There are certain hospitals, certainly within China and across China, where you can go and they only do the old traditional medicine, but they do a very broad spectrum of it. But most hospitals, even in China now, are very Eastern Western. If you need heart surgery, you go to the heart clinic. If you need gastrointestinal, you go to the GI area, and so on. If you need acupuncture, you go to that wing of the hospital.
And so as far as acupuncture, we'll talk more about treatment. We're going to see the procedure here in a few minutes. But when we're talking about the amount of needles used, is it in the course of how long it takes? Is it usually about 20 to 30 minutes? Does it take time to get them in, or?
It doesn't take very long. If I think when we go to out to the college, we'll see it being done, and you'll notice that Dr. Fuller, I believe, will just do it's literally a couple of seconds per needle. It's not like prepping for an injection. Quite, it's a lot simpler. But a treatment in our clinic generally runs 60 minutes. Now, that's about half of that is an intake with the patient. We're asking the questions.
Finding out what is bothering you, or what do you
it's
think?
Head to toe, top to bottom, front to back. We want to know everything that's going on, and we look for patterns. And once we ascertain what we believe the problem is, then we treat it. It's a specific treatment tailored just for that person.
Now, are there larger needles depending on the part of the body, or when I say larger, I mean like longer, perhaps?
There are, and certainly, there's a process or a procedure used in China, and we do it here as well. When we treat like post-stroke sequela and things with stroke patients, we do what's called threading, and we remove needles just subcutaneously underneath the scalp. And we put them in areas that are specific to the disorder that we're treating. So for example, a speech impairment or an impairment of gait and so on, we would use what we used this morning. I did this morning actually in clinic, what we call a motor area. And so we actually will thread a needle, if you can imagine, just under the surface of the skin and all the way up to the top and back down again. So that needle's probably about 5 or 6 inches long. Now that's a rarity. Most of the time the needles we use are simply 1 inch. And again, they're so flexible, you can tie it in a knot. So when we get somebody in the clinic the first time having acupuncture and they go, and every once in a while they'll say, I'm a little nervous. I don't like needles. I go, well, who in their right mind really likes needles? So I say the good news is it's more almost of a little microfilament. You're hardly going to feel anything at all in the process. So it's nothing like the needles you're used to.
Thank you, Dr. Wrench. And don't go away. When we come back, more questions with Dr. Wrench, and then we'll go back to the college to see the procedure up close.
Ever dream of helping people? At East-West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back to Natural Healing with Oriental Medicine. So, Dr. Wrench, we heard the president earlier talking more about acupuncture, but I think most people, when they think of acupuncture, maybe think of it as a treatment for pain. And we heard him talk about other things, even treating headaches. But what else can it treat, and how effective is it?
Well, Grant, I think the best answer there is what else can it not treat? The answer is acupuncture treats everything. I think we think about it as years ago people used to say to me, so you guys treat like sciatica and what, migraines? And we said, yes, well, but that's because why? Everybody eventually in their lifetime is going to have either back pain or a headache. Right. So I think because statistically 80% of Americans especially are going to have a low back issue in their life.
Go through these
and they'll get
things.
some help if they wish through acupuncture. And a lot of people, of course, suffer headache, discomfort periodically. But acupuncture treats everything. The interesting part of it is it doesn't have to be used after the fact. It can be used as a preventative. And we can, should I go into that now? Or okay. So there's something unique about acupuncture that drew me to the medicine years ago. And when we think in the general concept of what medicine is, we don't usually think about it being, and there's a word I'm going to use here and I've used before called tonifying. And I think if we look it up in Webster's, we won't find it. Maybe we will. But it's a word that means to strengthen, to boost, to encourage, to increase. So we actually, through acupuncture, know it's a fact. We can tonify specific systems. In most forms of medicine, there isn't, how can I tonify this?
Yeah.
And if we thought about it, we'd say, well, eat right, exercise, follow a sensible diet, and these things will strengthen the body. But we can literally tonify someone, as we'll see later in the program with Dr. Fuller, in a matter of minutes, where it's not unusual at all for a patient to get off the table and go, wow, I feel so different. And how do you feel? I feel better. I feel like I have more energy, or the pain went away, or I feel like
it's
I
like
could.
This almost clean lease. I know when I went through it, you have this just sense of calm about you.
And one of the effects, to your point, is that acupuncture lowers stress levels. I think it's
so
just
treating stress is certainly one of the many that you said. It pretty much runs the gamut. But stress treatment, acupuncture can be very effective.
Absolutely. And when stress levels go down, the immune system goes up. So it's like this little seesaw effect. The more stressed I am, the more I'm kind of taxing my system, the mechanism, as it were. And the less stress over here I have, then my immune response is stronger, and so on. And Dr. Fuller, I think, is going to talk a little bit about GERD, gastrointestinal issues. So many people suffer from these things. You know, our GI tract is where 80% of our immunity lies. But when that's on the fritz, we're going to know it.
What if you have chronic dental pain, or even like in your oral area? Is there something that acupuncture can do to help that?
There are some things you can do. In fact, it's interesting, and this is going to sound funny. I just treated that this morning, and if I keep saying that, our listeners are going to get, you do.
You're
we
busy.
Actually did that. There was a student in clinic this morning who had a tooth extraction, and she said, I'm here, but I'm not here, because I'm beside myself with the pain. So we did a couple of points, and one of the points right here is called large intestine 4. It happens to be a command point for this whole region. And so it'll help calm down. Now, look, if you need a root canal, you need a root canal.
Right.
If you need a crown put on, you need a crown put on. But it's not uncommon in China to go to the dentist and get a little acupuncture before and during the procedures. Absolutely. And you're sitting there, not necessarily in your face, because they're going to be working in this region, but certain points we know control the effect here. And so that's very, very common, especially in China.
That's fascinating. So as far as we're going to talk about, we're going to see the procedure, but is it painful? Is it painful?
You know, not at all. I should throw it back to you. Was it when you had it?
It wasn't. I felt just a little bit of maybe a pinch, for lack of a better description, but it really didn't hurt.
I think, you know, different people take different. It's like, I guess it's like getting a flu shot or having blood drawn. The times in my life when I had blood drawn, if somebody was really good at it, I always told them. I go, wow, that was great. You're really good at
Yeah,
this.
you found
You know, they go, hey, thanks. You know, and I go, no, you should know. That was great. I appreciate that. I think in acupuncture, some of us take great pains and not to hammer the Chinese from where this medicine originates, but in their country they're very stoic and they don't consider
They won't admit. Or
it's not a big deal. They just get the needles in. It's very matter of fact. I think in our country, we're Americans. We kind of want it our way.
Right.
So we go to great pains to make sure it's not uncomfortable. I'll give you an analogy. To me, a mosquito bite, to me, is worse than an acupuncture treatment. Much worse.
Wow.
So,
all right.
But I think in most cases, you feel nothing but the pressure of the little plastic tube, and we press very hard with the tube, then we make a little tap, and we're done.
That's it. So now let's go out to the East West College of Natural Medicine and see an acupuncture treatment being done.
Welcome back. I'm here in our student clinic with Dr. Brandon Fuller and Amanda, and they're going to be demonstrating an acupuncture treatment. Take it away, Dr. Fuller.
Thank you, Russ. So as we've been discussing, there's over 400 acupuncture points, and we use these small filiform needles to insert into specific acupuncture points along the 12 meridians. So what we'll be doing here today is we'll be looking at specific points to help treat different diseases. These are generally used points, so when you come into the clinic, you'll more than likely get one of these points. So this is what's called stomach 36, and this point is used to help reduce stress, but also boost the immune system. Now, the stomach meridian runs from just below the eye all the way to the foot. Along this meridian, as you would think, different points work for different syndromes. Mostly this helps boost the stomach, relieve nausea, also deal with things like GERD and acid reflux. This point is actually quite great because it's been researched and scientifically proven to boost the immune system after 3 hours with one treatment. The next point that we're going to use is called spleen 6. And spleen 6 is used again to help with reducing stress, but also to help with blood deficiency, or what we would call blood deficiency in acupuncture. So something along the lines of anemia. It's also used for different conditions. It might be used for skin conditions. It might be used just to help relax a patient. This channel actually runs from the inside of the leg all the way along up to around the chest area. The next point that we'll use is called pericardium 6. The pericardium is used for different situations. In this case, we're going to use stress. Amanda is working on her board exams to become an acupuncturist herself. And so using pericardium 6 will help reduce stress for her. So what we do for this point, there are 2 tendons that run on the inside of your arm. And we just tap the needle in like so. This point has been shown to lower heart rates. So with patients who have excessive heart rates, afibrillation, and other dramatic heart conditions, but it also helps with different things like mania and other psychological diseases. This last point is called DO 24 and is used primarily for stress reduction, but also for sinus congestion, any syndromes that deal with sinuses and the upper sinuses, So sinus infections, inflammation, headaches. It's a great point for reducing headaches and pain in the upper head area. The channel, when discussed, runs along the spine and all the way around the back and circles around the head into the front of the face or right around the lip. So all in all, these points, when combined, will help reduce stress, boost the immune system, deal with any heart palpitations or heart fluttering from nervousness. It can deal with sinuses and also with any blood deficiencies that may be occurring. All right, thank you, and we'll see you next time.
So we just saw the acupuncture treatment with Dr. Fuller and looked pretty simple, Dr. Wrench.
Yeah, and you know, looking at that, you notice that the patient on the table never flinched, never moved.
No.
And if you look closely at that, you'll notice that before he taps the needle in, he taps twice beside the needle. He has a very interesting technique, and we needle very similarly, but he goes tap, tap, then he hits the needle. So the patient confuses the tapping,
Doesn't
and they
understand.
actually they really never feel the actual insertion. It confuses what we call the site receptors. So it's a good little technique he used there. I like that.
Yeah, he's very, very efficient. And don't go away because we're coming back with much more.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back. I'm joined by Dr. Wrench. We've been talking about acupuncture, and what I want to ask is how long following a treatment can a patient expect to see relief? We did see that demonstration earlier.
Yeah, you know, I hate to be a little vague here, but whenever we get a treatment for anything in any form of medicine, there are certain factors that we have to consider. Number one, how old is the patient? Because when you and I are 20, we had greater recuperative powers than we do now in our 30s. Right? Yeah, right?
That's right.
Okay, so, but really our age is a very, very important factor. Number two is what exactly is the problem that we're having? Some things are obviously much more severe than other things. Number three, how long have we had the problem we're having? Number four, how severe is the problem that we're having? And so let's say it's pain, and my pain level is a 9 out of 10. Well, it's going to be harder to turn that around than it would the guy that's having a 1 out of 10.
A 5 or a 4 out of 10.
So we have to figure that. So it's really hard to say to ballpark, oh, you're going to feel this much better for this period of time. I think we could say we have a pretty positive prognosis here, having learned your medical history and so on.
A lot of factors sounds like go into play on that.
Yeah,
question.
you know, if I had a crystal ball and all that, I probably could be more accurate, but it's a little tough. So we have to go with the information at hand.
Now, as far as the effects of a treatment, how long do they last, and do you recommend every so often coming back, or how does that work?
Well, again, not to evade the question, but how long it lasts, again, depends on those factors we just talked about.
Right.
How bad is it? How long have you had it? Remember that patterns of disease in the human body are kind of memorized, and after a while, the body accepts a pain. Let's say a pain pattern, a chronic low back pain. The guy's had it 20 years. You've had it 20 years to degenerate to this point. Now, it's not that we can't make some serious inroads into the problem, but if I could turn that patient around in one treatment, I'd be the most popular guy on the planet.
Right.
But what we can do, and what we usually see, is quite a big turnaround after 1 or 2 treatments. And the pain, the reduction in pain is usually very significant depending on what the pathology is. So if a guy's got a full-blown herniated disc, wow, that's probably a surgical procedure that needs to be done.
Augmented with perhaps
Yes,
the...
but as far as pain reduction and seeing improvements, that's almost immediately. And again, it varies. When the person comes back to second treatment, we always say, since our last get-together, have you noticed any improvement? And we always say, however minimal it might be, and generally it's a pretty good percentage. I'm 30%, 40%, up 50% or more.
And that leads to the next question. So how many times do you recommend a patient go for treatment?
Again, it depends
more
on...
than once a week?
Usually we would. I want to specify here that, as we touched on earlier, acupuncture can be preventative. So for something that's ongoing with someone, they're having gastrointestinal distress or something, and we want to see them a couple times a week. One thing about treatment is, not unlike exercise, the closer together you lump these treatments, the more profound the effect will be. If I get a treatment once a month for 6 months, it's not nearly as effective, if at all, as if I did 2 a week for 3 or 4 weeks. It's much more effective that way. So it depends again on what are we dealing with.
Right, but a treatment pattern could go for maybe 3. Let's check after 3 months. Let's maybe readjust after.
It may be a
month.
lot sooner than that, Grant. Usually I say, let me see you 2 times a week for 3 weeks.
Okay.
Maybe 4 weeks, and then we'll reassess. We also may say, see you in a month for a follow-up, but for now you're good to go.
So what are some common treatments that we may see performed at the East West College Clinic?
Well, as we talked about earlier, everybody on the planet, somewhere they got a pain. So we do see a lot of pain because statistically everybody has pain. We see a lot of headache, we see a lot of GI issues, we see urinary disorders, we see...
Well, just chronic knee pain from like working in construction for 20 years.
The big 3, I think the big 3 for us is spinal pain, number 1, knee pain, and the most complex joint in the human body, because we use it so much, the shoulder. And you get, of course, you name it, we get it, ankle pain, carpal tunnel, you know, you get it, you see everything. But it's almost impossible to say this is all we treat. And in a lot of hospitals, especially in China, it's a tremendous adjunctive treatment to cancer.
So Dr. Wrench, we're almost out of time, but how does one go about scheduling a treatment at the clinic?
Call us we're 941-355-9080, and just ask for the clinic desk, and we'll be happy to answer your questions and schedule an appointment for you.
And for folks who may not know where you are, you're in right in Sarasota.
We are right down the trail, right across. If you know where, I'll give you a landmark. Sarasota Jungle Gardens, most everybody knows, right across the street on 41.
And of course, the website on the screen, anybody can go. Lots of good information there.
Absolutely. And again, give us a call. Remember, you got nothing to lose but your pain.
Dr. Wrench, thank you so much for joining us. And that does it for this program. We'll see you next time.